Hi, my name is Leslie and I'm going to be your nurse today. Anytime we enter a patient's room, we always want to identify ourselves. We always want to make sure we have the correct patient with name, date of birth, verify allergies. We always want to provide privacy. We always want to use GPSP, perform hand hygiene. We want to make sure the patient's in a correct position. We want to make sure that they're in semi-Fowlers, or for this skill today, we're going to be doing suctioning. If they are unconscious, we can lay them side-lying. We always want to assess their pain level. If they're having pain, we want to give pain meds 30 minutes prior. When gathering all of our supplies, it is important that we have hemostats, an oculator, a continuous pulse ox is on the patient, and an ambu bag is always at bedside in case we was to have any issues or complications. So we're going to do a round of hand hygiene. Again, we're going to assess the patient for pain. The patient denies pain at this time. So we want to go ahead and jump into a respiratory assessment. Anytime we do suctioning or any kind of trach care in a patient, we want to do a respiratory assessment. So when we're doing a respiratory assessment, we always want to check their lung sounds, the rate, effort, and their O2 saturation. When looking at them, we want to see if they're breathing really hard, if they're using any accessory muscles, any shallow breathing. We want to check for symmetry. So I'm going to lift the patient up. I'm going to look at their back. We're then going to listen to all their landmarks, and then we're going to feel. Go ahead and lift you up here. Take a look. I don't see anything, so we're going to listen. Then we want to feel around, make sure there's no masses or lesions, putting our thumbs on the thorax, having them take a deep breath in and out, making sure that our hands are expanding for chest expansion. We're going to lower the patient. And then we're going to go ahead and do the same thing on the front. We're going to look, listen, and then just feel, make sure that there's no masses or lesions on the front. From looking at the front, there's nothing, so we're going to go ahead and listen. And then again, feeling the patient, making sure there's no bumps or masses. So depending on the respiratory assessment, the patient does sound a little bit congested. So we are going to go ahead and proceed with tracheostomy suctioning. Before we start any kind of procedure with suctioning, we always want to test the suctioning, make sure that it is working before applying the catheter. When we are doing suctioning on adults, we don't want to exceed more than 150. 125 for children and 100 for newborns. We're then going to again make sure that we are checking the O2 while we're doing this procedure and the patient's respirations. We're going to wash hands, and then we're going to apply a drape in case there would be any secretions that were to come out while we're doing suctioning. Wash hands again. We're then going to go ahead and set up some of our sterile supplies. So when touching the box, you always want to make sure not to touch the inside, as that could break sterile field. We're then going to insert some sterile saline. So we're going to remove the cap. We're going to lip it, and then go ahead and insert some into the box. Move this out of the way. And we want to do another round of hand hygiene. We're going to apply gloves and our masks, just in case, again, there would be any secretions that would protect us. And then we're going to wash hands and we're going to apply gloves. Then we're going to move this out of the way. And then we're going to go ahead and begin suctioning. We're going to go ahead and take out the catheter. Making sure to keep our hands above so we're not breaking sterile field. With our non-dominant hand, we are going to insert the end into the suctioning. This will make our non-dominant hand no longer sterile. So we're going to insert that. And then we're going to go ahead and hyperoxygenate the patient. We're going to do this 3 times. Okay. And then we're going to test the suctioning. Taking the very end, putting your thumb over top and dipping that in. Suctioning looks good. We already hyperoxygenated the patient. When we hyperoxygenate, we always want to do 30 to 60 seconds, no more than that, and no more than 3 times. So we're going to go ahead and insert into the catheter, or the trachea. Get a good hand placement here. When inserting, you always want to make sure that you do not have your finger over top so that we are suctioning when inserting. We're going to go ahead and insert. When inserting, you want to go in until you meet resistance cough. And then when you're pulling out, you want to put your thumb over top to make the intermittent suction, going back and forth. Until you've removed the catheter. Then want to clean. Anytime we do catheter care, we do not want to do more than 3 passes and no more than 10 to 15 seconds at a time. Also with hyperoxygenating, like I said, we would do no more than 3 times. You could do 30 to 60 in between. So depending, again, if the patient would need suction, we will go for another round of suctioning. In this case, I think this patient is okay with just 1 section or pass. So we're going to go ahead and dispose of supplies. We're going to remove gloves. And we're going to do a round of hand hygiene. And then we want to go back and reassess the patient. We're going to go and look for, again, their rate, effort, if their O2 is still okay, their respirations are okay, and their lung sounds if they don't sound as congested. So like we did earlier prior to starting, with gloves on, I would also remove this. We're going to go ahead and do another assessment. So hand hygiene, look at the symmetry, look at their respirations, and use of accessory muscles. So again, we're going to go ahead, lift the patient up, look, listen, and then feel. Everything on the back looks okay. We're going to listen. Good. Still no masses or lesions. We're going to do another big deep breath to see chest expansion, making sure that our hands are rising. Lower back down, and we're going to do the same thing in the front. Just looking again. Go ahead and listen. Want to make sure that the wheezing or congestion doesn't sound as bad prior or to after doing the suctioning. That would indicate we needed to do it another pass. And then again, just feeling. So based off of the assessment, the patient doesn't sound near as congested. So I think that doing the suctioning was a success. Patient is not in any discomfort or any pain at this time. We're going to go ahead and lower the bed back down to a safety level. We're going to give the patient call light, make sure that they are comfortable, remove all of the supplies we used in the room, and we're going to document and report.